Well, thank you so much, viewers. Today we are talking matters of health, and with me here is Dr. Fred Oluga, who is the Secretary General of KMPDU. Thank you so much.
Thank you.
So today we are looking at the scorecards of the elected leaders, and I would like you to just start by giving us a brief info about your own assessment of healthcare in Kenya.
Um, I think the healthcare sector in Kenya is chaotic.
Really?
It's in shambles, it's chaos. Multiple strikes, people not getting the healthcare they need in the hospitals, even at the private sector level. A number of people in the public are complaining about malpractice, negligence, lack of affordability, lack of drugs. A lot of Kenyans who have a little money or who can access Harambes are going to India, South Africa. Majority of those who come here also pass on because they can be followed up. So there's just chaos in Kenya. You even see the politicization of issues of vaccines, tetanus vaccine, polio vaccine, sometimes the church is raising voices. So I think the description is just what I'm saying, it's just chaos.
But do you think, especially from the governors and the promises they made to us, do you think they paid some keen attention on healthcare in their manifestos?
No. I'm yet to see a manifesto that can solve the problems of the health sector. Not the ones that we saw during the elections, and that is actually to say it in a light way. That is to be optimistic, to be a little brutal, as of course I am sometimes. Is that I think the governors, the people who are campaigning, most of them from the governors to MPs, even at the presidential level, I think they served Kenyans a piece of a joke when you look at the manifestos. And when I say a piece of a joke, I don't mean I don't mean rocket or big things. I simply mean the things that can solve the problems of the common wananchi when it comes to health. So it is possible that the advisors of these people didn't take their time to research, but it is also possible that there were high stake political givings or takes that then couldn't allow issues to come to the table, which is also the unfortunate bit around sometimes politics and leadership. The issues that are important, like healthcare, like right now,
Yes.
healthcare is very important, but then it doesn't come to the surface because then people think that that wrangles for leadership is more important, but then they don't understand what those leaders should do. So I think sometimes as Kenyans also we need to give ourselves a break and maybe just discuss health, and then from that, then our leaders would actually know what to do. They would know that bickering is not going to sort out the problems of the people in Kenyatta National Hospital who queue for 24 hours, who have traveled from very far recently. And I think I may have to say this story. Recently, I was working at Kenyatta National Hospital. Contrary to popular belief, I also still practice medicine. So I see patients, but I don't do any private practice. I just do public practice. Then I also lead doctors. So I was seeing this lady who brought the mother. This lady, she's very poor herself. She lives in one of the slums in Nairobi. She is from Ukambani, and she had gone home to fetch the mother to bring to hospital because the mother had called her she's sick. The mother had been sick for 2 months without anyone noticing. And when she came to Kenyatta, she got to Kenyatta at 9 a.m. in the day. And so by the time I got to see her, it was actually the following day.
Oh.
At 9, and that was more than 24 hours.
Okay.
And she had been there just outside of casualty, and I was the first doctor to see her. And she started crying, and telling me, daktari, nilikuja hapa saa 3 usiku jana na mtu ameniona, mama ako weak. So I almost shed a tear, but I didn't because I was struggling. So I saw the mother, and then the mother had a very simple pneumonia. But the mother was so sick, and she had been sick for 2 months. Then I asked her why she didn't take the mother to the hospital. And she told me she had to beg the husband to give her 500 shillings to go collect the mother, because there is also no hospital in that region where the mother can go to, because all government hospitals are closed because of the nurses' strike.
Yeah.
And the unfortunate story is that when I saw the mother and I prescribed the medication, and then she was supposed to go to the ward because we had admitted her, she came back to the room, and I'd seen, of course, the mom was very sick. She came back and told me, Daktari, mama ameacha kupumua. And so when I went back, actually she passed on in our hands. We tried to resuscitate. And then I looked at her, she was so heartbroken, the effort. So you can imagine first the effort of just the transport from Ukambani, then her begging to go, someone to give her money because herself she's very poor. Then now coming, waiting 24 hours, you have not eaten, you have not been given medication. And if a doctor saw that lady, that mother, 24 hours earlier, I'm sure she would not have died.
Yeah.
But the daughter does not know. And the husband who had to dip in the pocket does not know, because the husband works in Mjengo, and now with all this politics, there's no Mjengos going on, so there's no
It's
money.
really affected work.
So it's really affected everyone.
Yeah.
So these are serious issues. They are not small issues. So someone loses a life,
Yeah.
and then they can't connect
Yes.
with that life. And I'm not so sure that the leaders that we have the ability to connect. Any leader worth his salt, if they can connect that story to the reason why they have been elected, they will succeed.
Yeah, I think just on the same line, right now we're seeing people dying in places like Baringo for diseases like malaria at this stage. Do you think maybe as a country by now we should be somewhere, we should be able to deal with such kind of diseases?
We should be, but we have refused to. We broke the healthcare system when when the people started handling issues of, who do I want to lead this, who do I want to lead this, and therefore we broke the chain of public health, health promotion and things like that. So it's not a surprise that malaria is having a breakout, because then you find doctors or nurses there and then you chase them away because you want to employ your cousin who is a lab person, or who you hear has been a doctor, but probably this person is a quack. So those are things that are going on.
Yeah.
Governors have said before that they find veterinary people in hospitals treating human beings, and they claim they are doctors, but they're not doctors because they're not on any register. No medical school can claim to have taught them. And even the many people that hangaisha wananchi out there, some of them are not doctors. So these are all things that are there. But I think also to say that the governors or elected leaders, the reason why they will be voted out is because of health. And let me be very specific to governors, and this is actually not a joke. 20 governors went home. The reason why those 20 governors went home was because of health. Yeah. So any governor who wants to be re-elected, and I'm very happy that some of them, like Mandi governor, have already taken the queue. Any governor that is looking at a re-election must look at health. Yeah.
Can you point out maybe specific counties that, from your own opinion, maybe are doing better?
When it comes to health in the whole country, we are all doing badly. But then there are governors that we can say are having initiatives. And one of those governors in the first phase of the devolution has been Governor Ongwae. In terms of addressing the doctor-patient ratio, he's been employing doctors. Kakamega, they have also been very progressive. It's the only county in the previous devolution phase that didn't face a health worker strike, except for those that were national. So there are those counties. Kiambu, actually, Kabogo did very well, but in terms of infrastructure, and he did real things. in terms of trying to improve the status of hospitals. The only thing that he didn't do well was the treatment of health workers. But overall, I can still give him 4 out of 6. Um, and because he didn't treat health workers right, he went home anyway. So all the governors the only governor that I can say survived, and we don't understand how, but he also mistreated people at Jamo. All the other governors that mistreated health workers or mistreated healthcare went home. All of them. Yeah.
Okay.
Yeah. Starting with and it's true, if you look at the pattern of all the governors that were voted out, it was purely health. So it's a very serious issue. So these governors that have come in, especially the 20 of them that I knew, you want to be re-elected, look at health. It's because people, you see, it's something that people connect with. Yeah. You connect with the fact that I took my uncle to hospital and the hospital saved him. You connect with that instantly. Yeah. And the other thing that I can say to the governors is that health is not just about buildings. Health is not just about equipment. Health is not about launching drugs. Health is a whole system. And this system starts with how much money you allocate to it. It starts with the leadership, your own leadership. And when the governor of Nandi, Governor Sang, says that himself he will go to the public hospital, that's a good thing, because then you want the quality to be one that even yourself you would like. So leadership, health needs workers, and those workers must be in good numbers. In places like Seah County, the number of MCS is more than the number of doctors, for example. So it is true. Yeah. In many places, So if you look at health, is a whole system. So you look at the workers, look at the leadership, look at the money you're putting in, look at the systems of the supplies, like how to supply drugs, how to supply vaccines. You look at how health information and data. You have to promote health, like malaria outbreak in Baringo. It's sometimes you look at Kenya and you think that this is what I call, it looks like a mental hospital compound. When you go to a mental hospital, people are just doing their own things, because the mind is not working very well. And I think sometimes Kenya looks like that. Like Baringo, we are having malaria outbreak, and malaria is still the killer disease. It's still the number 1 killer disease for children, by the way. Malaria medicine is 40 bob, but that's not even the thing. Just going out there to teach people on how to use mosquito nets, to slash, to even you as a governor, if you spent money buying outdoor sprays for mosquitoes, you'd spend less than 5 million shillings.
That's true.
For the whole county. So sometimes it's a little bit of madness that these things are going. 5 million shillings is what the governor will use for one meeting, in terms of either inauguration. So it's not big things. So health is not big things. Health is small things. And for us as a union, in this second devolution phase, and myself as Dr. Luka, I'm available to guide some of these governors, and also to work closely with them, because this is our country. We have to make the necessary steps.
Great. Maybe we delve to the strikes. I know it's really affected the healthcare. What is your own analysis of the strikes? First of all, how far is your CBO?
As ours, we are starting to implement. We just had a meeting with the Council of Governors today, Ministry of Health yesterday. So we are already putting up an implementation plan. So we are doing, we are making necessary steps to make sure that every single thing that we promised Wananchi, that we put in that collective bargaining agreement, we are going to do it. The most important thing is the governors and the counties and the national government to have the goodwill, because some of those things will still require financial implications, particularly the issue of employment of doctors, the issue of equipping facilities for patients. Because doctors can't work without equipment, without gloves, without X-ray machines, without other health workers. But I think the issue of strikes, it's very unfortunate. For nearly 240 days, there has been no healthcare at all in the public sector. 240 days out of 360, and it's still ongoing. So I think we have to come back to a little bit of our senses and look at why are these people striking. The approach that the government has taken, that of grandstanding, is very unfortunate, because if you have employees, you're already more powerful than your employees, so there's no need of comparing your power. And these are employees anyway.
Yeah.
So it's, oh, he'll sack you, threats. It's stupid. It doesn't work.
Yeah.
So I think just sit down and dialogue works.
Yes.
And the reason why those strikes are there is because there are no dialogue.
Wow.
Like the nurses strike, they have been on strike for nearly 130 days.
Wow.
Or more. That's more than 3 months. That's more than 4 months. And if you look at the number of meetings, there have only been about 15 to 16 meetings, and all those meetings, there have been no tangible outcome. So when people, when people don't sit down, even small issues look like big issues.
Yes.
So when you sit down with health workers, and if you look at people who have gone through the trenches like myself, and now we are trying to help the nurses also mediate between them and government.
Yes.
Then even big issues can be solved. Then the healthcare issues are small issues. But there are small issues that can be very big, because they are matters of life and death. So in terms of financing, in terms of prioritization, in terms of just looking at it, in my own opinion, if people want to sit down and talk, it's a small issue. If people do not, then it's a big issue, because someone's going to lose a life. A whole county, the population lifespan is going to go down. And if you look at later on the impact, maternal mortality, children's deaths, gross domestic product, because productive people are people who are healthy. Yes. That's why in some counties, and sometimes I like to use the western counties, counties like Siaya, counties like Busia. How can people who are sick produce? So these are counties that will forever depend on taxpayers' money. Yes. And government sending them money, because there's nothing that's produced. If you want to tax people in CI, what are you going to tax? They are very poor.
Yeah.
And these are real issues. And yes, you may want to tackle poverty, but the real problem sometimes is the health. Because a productive person is going to open a shop there, go to the shamba, do some. So even if you say that, by the way, we are going to charge this fine for this agricultural produce in this market, yes, you can generate income as a county. If you have hospitals working, you can have shops outside those offices. When doctors come to your county, you will have rentals, and you will have supermarkets there. So the health is a very huge economy. Okay. So it's not just a small economy. But when you leave health to die, and then some small shops come selling drugs, even those will die. Because soon people cannot afford, because they have nothing to produce. So they prefer to die at home. And you've seen in far-flung places, older people, not even some older people, actually saying, don't take me to the hospital. I don't want you people to sell our only cow. Let me die at home.
Oh, that's very sorry.
Yeah, but this happens in the country. So the governors and the president, they have real work to do. And sometimes I look at them and I think these people do not know why Wananchi elected them.
Yeah.
Because those are the problems Wananchi want solved.
Oh, that's great. And looking at different countries, if you just put Kenya aside, do you think like the use of technology, there are certain technology that we can import in the country to help us in certain areas of healthcare?
Of course, technology is now taking shape in every sector, not just in healthcare. Yeah. And in healthcare, I think there's a lot of technology in terms of artificial intelligence, robotic surgeries, use of laser technology, diagnostics, and a lot of things. But also in terms of sharing information, in terms of what they call virtual consultations or virtual clinics, where some diseases you don't have to come to hospital, you can refill your medicines, or people just send for you prescriptions. So yes, of course, technology have a role in medicine, but you can never replace the human face of medicine, because medicine is based on a real sense of feeling. Me looking at you, Alphonse, and saying, I think you're stressed. So that even when I know that you don't have a disease, when all the lab tests are normal, I can still treat you as a doctor, because I can examine you, I can know that this one has pain here. So technology can never replace that. So technology will aid medicine, but technology will never replace the traditional aspects of medicine.
Okay, thank you so much. We are going to have a break, And when we come back, we're still going to have Dr. Fred Oluga giving us his final remarks on matters of health. Today we are looking at a healthy nation. Okay, thank you so much. Welcome back, and here with me still is Dr. Fred Oluga. And Dr. How does your schedule always run? I know, like, you are the Secretary General, and you're also a doctor. How does it look to be a doctor?
Being a doctor is great. You get to touch people. You get to interact with life at the very vulnerable. Occasionally, people smile in hospitals also, and their person is being discharged from the ICU or a mother has given birth. So being a doctor makes you interact with humanity in a way that just out there doesn't give you. So for me, I think I really appreciate that fact. But of course, it also is very busy. You don't have any regular hours. You work weekends, nights, and then coupled with my work, already being the Secretary General alone is like 7 jobs in one. Very unpredictable, very complex issues. You have to engage with members of parliament, governors, sometimes the president. And that in itself is crazy.
I know this show is watched by the elected leaders, it's watched by the president himself, it's watched by the governors, the senators, the MPs, the women reps, it's also watched by the MCAs and many other people, generally the voters. Maybe tell us something just about KMPDU.
So KMPDU is a trade union of doctors. We are 6 years old, registered in August of 2011. And KMPDU has, I can say, is the voice of good in healthcare. I know that many people know us because of maybe the last strike, or maybe because of agitation for our workers and our members. But KMPDU has made very key improvements in our sector. In 2012, KMPDU signed with the government what was called the Musimi Task Force Report. What the president was launching in terms of putting equipment in hospitals was a KMPDU initiative.
That's great.
So if it was KMPDU that signed with the government that they will go and put equipment in hospitals, that whole big thing worth 38 billion shillings. And the president went, and sometimes some governors had issues. And of course, we even told it was because of consultation issues, though. But that was a KMPDU project. Last year, not last year, this year I saw a number of people talking about job opportunities, or we will do an internship program. We have worked with the government, and that was my initiative to develop what's called an internship policy in 2015. And now millions and millions of youth will benefit from that if the government is serious to implement an internship program. That was our brainchild. We pushed government sometimes to the wall. We went to Pan-Africa, we went to all these places, and with the Cabinet Secretary Macharia, we finally presented this to the cabinet. And I was very glad when I saw the president and his deputy campaigning and telling youth, we are going to give you an internship program. Finally, I said, this is what I want. This is how I see the fruits of my labor. And yes, of course, we are the voice of reason also in healthcare for the public. So when there are no drugs, when there are no gloves, when you're not getting the best care, KMPDU is the voice that can talk about it. So we are inviting everyone, let's make our healthcare better. Leaders must know that leaders must make the people prosper. People can't prosper without health. And therefore they have a big mandate to ensure that their populations are healthy.
Okay, thank you so much.
Thank you.
And for the sake of our viewers here, we connect the elected leaders by giving them a scorecard or looking at what they do on various issues. Now, Dr. As we end, I just want you to look at this camera and speak to an elected leader. I know right now they don't know, some of them may not know what to do or how to tackle issues of health. That is a governor, a senator, women rep and MP, they may not know, they may not know really how to handle health. Maybe just look at that camera as you end and just speak to them.
Dear elected leader, your people gave you a mandate to not just lead them but to solve their problem. One of those problems in this country is health. You, as an individual, may not have an expertise in the area of health, but the people will still expect that you give them a way forward to ensure that when they go to that hospital that is near them, they get treated. The advice that I would give is that there are people like the union, they are experts that can help you, because health, education, security, these social sectors fall or rise on leadership. That leadership is yours. The mandate that the 190 and the electorate give to you is to solve their problem. Take responsibility. Take responsibility. These issues can be sorted out. Health is a big thing. Health is the reason you will be elected back.
Thank you so much, and it's all about health. Okay, thank you so much, viewers. We have to end it there today. And with me was Daktari. We really appreciate
Thank
you
you,
for
Alphonse.
getting time for us. And till next time, you should always keep it here on the Scorecard TV by my aspirant, my leader.